Age UK says that hundreds of thousands of elderly people unable to feed or bathe themselves are being excluded from social care. Joining us now, the Chief Executive of the Social Care Institute for Excellence. Thank you very much for being with us, Mr. Hunter. Let's start with the figures here, because I do think they deserve to be repeated. 2.3 million people aged over 65 have difficulty with either bathing, eating or clothing themselves, but 1.2 million don't receive the help that they need. How surprised are you by these figures?
Well, I'm not surprised. It's a situation that has been building for years really now, and in many ways this is a product of something we should be pleased about. You know, people living longer, people with disabilities also living longer at home and needing care and support, which enables them to lead satisfactory and fulfilling lives. So no, I wouldn't say I was surprised.
The thing that struck me most about this story this morning is these are basic activities, but according to the government's own guidelines, these people do not qualify for social care. Why exactly is that?
Well, because with the extreme funding pressures on local authorities and health as well, it's become more and more difficult to do kind of what we always did, and especially at low level, helping with shopping, cleaning and so on, really. But, you know, health and local authorities are working very hard indeed across the country to use the services, to use the resources they have to maximum effect. All sorts of schemes, you know, helping people avoid falling in the home, which often leads to hospitalisation, to get people out of hospital early and to sort of services which can help them regain their confidence, you know, with physio, occupational therapy, district nurses, health visitors and so on. So there's a lot going on, but there's no doubting that we have a very serious situation out there which together we've got to tackle.
The whole tone, though, of the national conversation does appear to be prejudiced against older people in our society. We refer to old people who can't leave hospital to return home because of a lack of social care as bed blockers, for example. I mean, why has this situation come about where we can't even care for those that raised us?
Well, I agree with you. That terminology is absolutely appalling, to actually blame somebody for being in a bed that really people don't want to be, and they want to be leading happy, fulfilling lives. And let's stop treating elderly people as simply recipients of services. If I can go off piece, as it were, for a moment, my mother sadly died about 15 years ago. She got services to help her get up in the morning and fed and so on, really. She then went across the road and helped at the local school, local primary school, doing work with the young children on reading and talking about what life was like as an older person in Doncaster. That was great for her self-esteem, kept her mobile, kept her contributing proactively for much longer than would otherwise be the case, and consequently great for the school, great for the community, and certainly postponed her need for more intense services. People are much more than simple recipients of services.
I mean, you've highlighted an issue there where it is rather difficult to be empirical about the fragmentation of society and the demise of communities. At the same time, we can be very specific about a lack of funding for social care. I mean, does it all come down to cost in your mind?
It doesn't all come down to cost. There is no doubt that the system needs injection of funding across health and social care, and it needs that money to be used well as well. But again, there are all sorts of things which health and local authorities are doing, helping people at local levels to make connections, using people's strengths as well. I know of another situation where a lady gardener, she had of some repute, was in a wheelchair, no longer able to do that herself, but actually supervised some young people on a community service scheme, you know, tending bushes, looking after flower beds and so on. So her skills were utilised for longer because of services that enabled her to live a full and productive life.
Tony Hunter from the Social Care Institute for Excellence, thanks very much for being with us.
Coming up.